so inspiring almost to hear other people, but sometimes it can be intimidating to hear other people's journeys and think that they've got it all figured out. Well, and you guys saw the level of conversation that we had in the last two panels, right? They were really amazing people that are here and giving us time. And we have the same thing now in this panel as specific to this world when we talk about data and we talk about the frontier of medicine and we talk about, again, the frontier of mental health. So I think, again, it'll be very exciting to hear from those. And so the quote that will lead us into this.
How will technology impact and improve patient care in the hospital setting, and will it improve outcomes to reduce
morbidity
and mortality rates?
I mean, that's really the goal, right? We want to be able to live healthier. We want to be able to live longer. It's an interesting question about how long we actually want to live at some point. Will we be able to reverse death and aging? Is it just a technology problem? But I think right now we want to be able to live healthy. So we'll please welcome the three panelists that we've got. We've got Kate Niederhoffer, who is a senior researcher with BetterUp Labs. We've got Ben Finlay, who raced over here from a brunch that he was having with all of his clients as a chief innovation officer for Publicis Health, which is a big, huge healthcare consultancy. And we've got Victoria Ngyuen, who is in the position of changing, but she's a big data frontier person. I don't know what the word is, but has worked in data. She's had a really, really interesting career path. So I think all three of them will have a lot to offer. So shall we invite Kate, Ben, and Victoria, please join us in our fascinating stage.
Please, after you.
So the way that we've been doing this, Ethan's trying really hard to keep us on time. We're not doing such a great job with it. But in about 7 minutes, each of you will share your career journeys, past, present, and future. And so the idea is sort of where you started, kind of some key, milestones in the run.
Thank you.
And what is your passion in working on now? Sound good?
Say it one more time.
Where you started. I mean, I think that people are always curious about where you started. Like, what did you study, right? And then what were some of the twists and turns in your career that got you to where you are now? What do you do now? And what are you passionately working on? Does that sound good?
Would you like to start?
I think Ben wants to start.
I'm a British person, so I'd say ladies first. But I'm very happy to start if you'd like me to.
That'd be wonderful.
Okay, cool. Hi, everyone. I'm Ben. I was quite...
And we have to project into the room because your microphone is actually for the recording, not for
I
the
see.
room.
I'm sorry. Here we
So
go.
no.
Everyone hear me at the back? Yep. Great. Okay. My name's Ben. I was kind of puzzled when Emma reached out because I was a terrible student when I was younger. And I figured, actually, there could be a reason why the universe is calling me here today. I studied sort of moderately at school and just got by with a few grades that were sort of enough to sort of leave school with some sense of achievement. I actually took a year out and I decided I'd sort of do some manual jobs to sort of figure out what I wanted to do. So I was a landscape gardener, I was a farrier's assistant, guys who shoe the horses. And I realized that this wasn't for me. So I decided to go to a local corporation in my hometown up north and work as a research scientist. And
Sorry, how do you go from chewing horses to research science?
I just liked either animals or biology. So I was like, you know what, let's do this. And it's there where I met the first person who influenced my life to some great degree, a guy called Bob Johnson. And he said to me, you shouldn't be like emptying the bins or sweeping the floor. You should be studying at university, and we'll put you through university as part of our undergrad program. And I'll never forget that moment, right? He saw in me something. I had no clue what he saw, but he saw something in me and he put me through university. And then from there, I've kind of stayed in life sciences. I've had a couple of roles with a large US firm, Medtronic. People have heard of Medtronic. They do pacemakers and other devices for diabetes and such. So I had a large kind of corporate role with Medtronic after leaving the research science role. And then I suppose for about 16 years, I've been in healthcare. And in one shape or another, I've kind of had this ability to move around in different roles. I studied a master's in my spare time in business change and innovation. And that was self-funded because I was really interested in it. And I think on reflection, I suppose I'm the personality who will dive into something, and if I like it, I'll stay there. If I don't like it, I'll figure something else out. And I've seen that as a fault for many years, but recently saw that as a positive trait. It's something that's quite, I suppose, in some ways relinquishing just to this element of control or a career path, or you'd be a doctor, a lawyer, a surgeon. That just isn't me. So the last 8 years, I have worked for Publicis Health, They're a French-owned multinational corporation. They're part of a bigger group. So we are 92,000 employees across the globe, 52 countries. And in Pub Health, we create new services around the medicine. So we research through ethnography and design research and all kinds of wonderful stuff. We look to build new, typically digital services, but they often include physical touch points. We look to include and orchestrate all the things around the therapy, around the point of diagnosis, around the point of repeat appointments and other kinds of things. And the services that we provide and create are typically sponsored or co-sponsored by the pharma industry or medical device companies, or sometimes state-funded or private health systems and services. So I live in London, I work a lot in the US and elsewhere around Europe, and I think I had a little image that I sent over, I'm not sure where that is, but the two words on that image were "stay curious," and I think that's kind of my motto that I've just found as of last night when I thought about today. I thought, what is it that embodies my approach to life? And I've got like an 18-year-old nephew it reminds me of me when I was back in those days. He's terrible at studying, but he's highly capable. And he lacks focus, and I think because he lacks the purpose or the determination or the end goal. So my advice to him was, put the hard yards in now, right? Do the work now to simply demonstrate that you can commit to something. Even if you don't enjoy it, just do it, because it'll make your life a lot easier without retaking grades and trying to, find clearance access to other universities. So my motto is stay curious and always work hard and be nice to people.
There you go.
All right.
Thank you. There's so many questions I have about Publicis Health, because I thought that clients came to you and you did solve problems for them. Are you actually innovating a solution and then finding sponsors for it?
That's a great question. So there's about 14 different brands within Publicis Health, and they are media, they're creative, you name it, a bit of health tech, a bit of phygital, physical, digital. I run a small kind of innovation lab, if you will, and we don't really work to a brief. We'll find the brief. Right, so a customer might say, in fact, I've just given a talk half an hour ago downtown on healthy aging, and we've designed an entire program with the National Health Service in the UK. It's taken us 5 years to get to 3 iterations of a new digital service, and the brief didn't exist 5 years ago. They just, the partner client and us, we decided on a couple of problem statements and said, right, let's go to industry, let's go to public, let's go to community and hospital services and research and look for those gaps where perhaps the health service is falling down or letting people down in their aging journey. And fast forward to present day, we've released a digital platform that helps people to combine a few things around social and behavioral change, nutrition, activity and wellness, and with a focus on longevity and improving quality of life. So we kind of make the brief rather than respond to a brief.
How fascinating that is,
Yes.
right? Especially inside a big organization like that. And I will say this whole conversation about healthy aging and what aging will look like and digital tools. Like I'm trying to imagine, when I get to 80, I'll have become so much more comfortable with a certain set of tools that my father, who's 80, does not have. So that whole conversation about how you integrate with my well-being 30 years in the future is really going to be fascinating.
Well, we actually worked with a company called Abbott Nutrition, headquartered in Chicago. And their brief to us was, we're just losing market share, just help us. They were in panic mode 5 years ago. And we said, well, you guys know your products, your nutritional stuff, you don't know the products inside out. There's no point us looking there. Let's look at the services around care orchestration and how nutrition is in the health system. And we've launched this service with them, and they were like, we had no idea that there's a lack of data on where when a patient has passed between different points of care, or that in the UK, your general practitioner or your nurse or your chief consultant, it's illegal for them to prescribe nutrition and diet to a patient.
Oh, wow.
Only a dietitian can do that. It's a specific course they go on, so on and so forth. So we find the itch behind the scratch to create something new. And in this case, it was all about longevity and healthy aging. But interestingly enough, when we went back to Abbott and said, hey, we think your prime audience is over 65 and frail. They were like, you have to be kidding us. There's no way that's our target market. It turns out the National Health Service, they spend about 15 to 20 billion on avoidable things that happen to aging people. Wow. And we were like, well, look, if we can siphon off maybe just $1 billion of that and create preventative design interventions, that's like quality of life improvement, it's a reduction on the care system, it's everyone's happy, no one's breaking bones, and all of a sudden we've got this two-way business model between industry and public health.
That's very exciting. So it's always exciting to hear a breakthrough, as opposed to we hear so many other things that are going wrong. It's really exciting to hear when things break through. Mm-hmm. So that takes us to you, sister. Thank you, Ben. Victoria, you have a very interesting journey.
Yes, my journey has definitely not been linear. It's kind of been all over the place. I'm also going to probably be the least technical head of data and analytics that's ever lived out there. So let's see, where do I start my journey? So I tend...
Don't hear Victoria in the back?
Can you hear me? I can use my command voice. Okay, here we go. Awesome. All right. Well, good morning, good afternoon, good evening, depending upon where you are. Obviously, good afternoon here to folks joining us in Austin. Nancy, thank you for having us. This has been just a wonderful day and really wonderful to be interacting with folks in the audience and fellow panelists. Let's see, I'm going to start a little bit earlier than high school because my journey is, I also don't like to follow rules. So obviously Asian, although I'm blonde. I remember kind of bucking the system at the age of about 6 or 7. I remember sitting my parents down very calmly and telling them, hey, listen, I know you want me to be like a pharmacist or a doctor or, you know, a lawyer. And I broke it to them, probably not so gently, that I wasn't going to be any of those things. As a Pisces, I feel creativity deeply, but I have no artistic skills. And so I was really happy to hear kind of the discussion on the panel previously about, you know, creativity doesn't always look and have to be coming from a certain type of person or, you know, somebody who studies creativity or arts in school. And so that was something kind of like Ben, where I had felt was, you know, something that I needed to improve upon, but has actually ended up being something that's been a valuable trait that I have because it's forced me to learn and be creative in other ways. So fast forward to high school, I really love the environment. I love the outdoors. You can find me trail running most days. And I really love hugging trees. And so I studied in college environmental science along with journalism. I thought I was going to go to Columbia and study science journalism and go teach the world about environmental issues in layman's terms. And then somehow I ended up getting recruited into the Department of Defense and the national security apparatus. So I joined, totally made sense. Well, so I was a freshman when 9/11 happened. And when I graduated was kind of the peak of the war in Iraq. We were getting ready to surge troops in Iraq. We were getting ready to put troops back in Afghanistan. And I joined at this just really interesting time. And if you remember back in 2005, 2006 was really the first time we started using more mainstream the term big data. And so here I am, bright-eyed and bushy-tailed, working with the special operations folks, various 3-letter agencies, trying to hunt terrorists. And it sounds very weird, but we were trying to figure out how do you make sense of all this information, that data that exists out there. And again, liberal arts background, but worked really closely with developers and engineers who sat right next to me. And they are truly creative because they would literally watch me fumble through stuff or try to figure out how to do something. And we're like, hey, let me write you 3 lines of code so that I don't have to watch what you just did again, right? Because like that was awful. And they just became such an integral part to our process and to this kind of cross-functional team we were developing. So, you know, General McChrystal, he built these JIADFs, these joint interagency task forces, where we were forced agency to agency to sit down right next to each other. And that gave us the opportunity to really learn about each other's data. So we're taking and synthesizing all of this information. And that, believe it or not, has been the driving force for the rest of my career, which has led me to venture capital. So I'm currently, and I'll be exiting at the end of this month, because I'm going from, you know, being what I would describe as more of an intrapreneur to trying to figure out how to be an entrepreneur. So a few years ago, I moved down here to Austin. I'm based here now to join a life sciences venture capital firm. And so that's how I think I ended up on this panel, because I feel a little bit of imposter syndrome. And through that experience, right, trying to apply a lot of the data methodologies and kind of tech stack integration challenges we had to a completely different vertical. But there's just so much that aligns, and especially in healthcare. I'm seeing so many of the same data challenges. And so for the last 3 years, we've been incubating a company out of the firm called Deep Surgery, along with a bariatric surgeon, general surgeon out of Mass General Hospital in Boston, and a computer science professor at MIT and Harvard. And so we've been doing that for the last few years, trying to figure out within the system, what are we trying to solve for, and what are we really trying to achieve? Everyone talks about AI and ML, it's super sexy, right? But the real unsexy problem is the data problem, and you have to figure out where that data resides. And a lot of hospitals and organizations have these digital strategies, but they have no idea how to even collect that information, where it sits. You've got surgeons who, will record an endoscopic or a laparoscopic surgery on a thumb drive, and then walk out of the OR and then go throw it in a drawer at their desk. And nobody else has access to that information. And so there's still these really, I think, simple things that we need to happen in order for us to leverage data within healthcare. And then specifically what I'm focused on is in the digital surgery space to actually improve outcomes. Now, while that's what I'm doing now, I'm also figuring out a couple other things, but one of the things I'm really interested in, Ben talked about, is longevity, or this idea that we can change the trajectory of our health span to meet our lifespan, right? So if you think about your lifespan is how long you live, and your health span is how many healthy years you have, right? I think the statistic is 20% of the end of your life will be spent sick. And so on average for us, that's 16 years. And so how can you improve it so that really it's just the last couple of years? And there's a lot of data. There's a Harvard researcher and professor who's done a ton of research around this. And it shows that we can actually reduce by trillions each year if we think of aging as a disease, and think about it from how do you prevent aging, because aging is what causes heart disease, right, and other metabolic diseases, causes cancer. And so if you think about it and go back to the symptoms, so we're really talking about functional medicine at this point. And I think that's really interesting, especially for you all in this room, as you think about if your health span extends and you're not looking to this thing where even myself or my parents, right, look at the golden years where you're tired, you're spent, and you're likely sick already to enjoy life. What if you could enjoy life and be more productive and keep your cognitive function high? How does that change work for you? How does that change not just work, but your life and the blend and the mix and kind of how you put those things together? So I just turned 40 this week. I still have no idea what I'm doing in my career. Thank you. I'm very excited about this next decade. And one of the things I'm grateful to have now is a system in place, a system to evaluate where am I in life? How am I doing in terms of my health, the love and the connection I have to the people in my life, the work that I'm doing. So I'll throw out two kind of systems that I really love that work for me. One is this concept of ikigai, which is a Japanese concept. So the Japanese are the longest living people. And the word is really about what's your purpose, what drives you, and there's 4 elements to it. It's what you love, what the world needs. I'm trying to remember all 4 of them because I'm on the spot. What you can get paid for, right? Yes. And the 4th, I'm just gonna forget. We'll just give me a little grace on that one. But that is kind of a system that I'm constantly evaluating what those things are for me, and that's going to help drive where do I want to go next with my career. So how many of you in the room have been asked, what are you going to do with your life when you graduate? How many of you have any clue? Right? And you don't have to. My response was, and I think I've stayed true to it, when people used to ask me that at 2020 was, it's not a matter of what I'm going to do, it's when I'm going to do what. And that has been probably the motto of my life. And then the second thing I want to leave y'all with is, as a system, right, for creating this life that you want to live, is a book called Designing Your Life, which is actually taken from a college course at the D School in Stanford, where they actually teach you to apply design thinking principles to your life, and not just your work, but to your whole life. So I will leave y'all with those
That's
concepts.
interesting. Yeah, that actually, I think, became the most popular course at
It did.
Stanford,
It
right?
did.
And I think that they also have it in Yale or some of the East Coast schools. I don't know if you guys are doing this at ET, but the whole like designing your life thing. No, it is actually, it's been for several years, it's been a super, super popular course, because I think there are so many questions around this, and where it is that we go. I love it. See, this is how you create action right here. You just put all the right people in the room, you make an impassioned point of view about why it matters, and then we go do it. So I appreciate that. There's a question I was going to ask you while you were speaking, and then you went to so many different directions that I wasn't sure which one to go to next.
Yeah, sorry, I was a little all over the place.
No. I think it's fascinating, because I think, again, it shows that the same thread of curiosity can take you to all these different things, right? From environmental science to the Department of Defense to hunting down terrorists to thinking about how we think about deep surgery and the role around that. So I do think the question around how long we all should live will be an interesting question that is soon, I think, will be one that we'll be faced. Will we actually have the choice of how long we want to live and what that looks like? So with that, the question is, how happy are we as we go through this, and how are we managing all facets of our health? Kate, so tell us who you are.
Something that I'm interested in studying. I'm Kate Niederhoffer. Thank you for having me here. Thank you for letting me listen to your very interesting careers. One of the things I'm really interested in, just sort of reflecting on what happened, is people's expectations of what their career trajectories and growth curves are like. So if you were to kind of close your eyes right now and picture a y-axis and an x-axis and a line that goes in any direction there, how would you think about your growth? And that's one of the things that I study at BetterUp Labs. So BetterUp is an organization, it's really a human transformation platform. The primary offering is coaching, and the idea is to develop a suite of services or interventions that help people increase their purpose, passion, and clarity. So I work in an innovation lab. I'm a social scientist, a social psychologist. I did my PhD at UT, actually taught in this building on a different floor, I think, or maybe even just right down the hall. So I did my PhD in psychology, which is a few buildings over, but I also taught in communications and advertising, funny enough. But I wanted to start, I'm reminded by looking back there and seeing my name. What am I all about? So I will start, maybe I won't date myself, but I'll tell you that I played ice hockey in high school and college, and I really identified as a team member. And one of the things that's always been interesting to me is why people do what they do, not in the sense of a career, but very literal things, like why do you behave in certain ways, what motivates you to do things, what is your personality like, and why do you act the way that you do and use the words that you do. So I think being on a team really seeded that, planted that seed in me early, and led me to study psychology in college, and then to go to graduate school here and just understand more about what makes people tick. In particular, I was in a lab where we studied the words that people use. So what can we tell about people based on the words they use, in particular their linguistic style, not so much the content, but the way that you use pronouns and function words and articles and pronouns and conjunctions. And those turn out to be really interesting markers of your psychological orientation and how you relate to other people, how you see the world. And so, funny enough, from there, I, through studying my dissertation, found on Craigslist a company in market research that was studying what brands can do based on how people are talking online. So in the old days, we used to talk about blogs and Usenet and discussion forums. In modern parlance, we may say social media. So I worked for a company that was trying to do some early text mining to figure out what we can learn about brands and companies and people, discussing illnesses and all those things just based on words. And that was really interesting for me. I think like that's what's driven my career, is like, am I finding it interesting? But it was getting me further and further away from the people themselves, especially as that startup was acquired by a large market research organization. And I just felt like I was moving away from the people and wanted to touch the people. So through a few twists and turns, working at more of a consulting organization and trying to develop services, which I think is where I met you, Nancy, which we called social intelligence, but really was more like marketing analytics and didn't feel like the social intelligence, which is what I was interested in studying in the beginning, is like, again, why do people interact the way that they do? So I developed an app called Sooth, and the idea was the goal originally was to help women to figure out how to get honest advice on balancing some of the identity shifts that we have through home life and professional life, and to really just get honest advice from people who you know and love. And through that process, we were able to analyze the data to figure out, is there really such a thing as good advice? So using those text analytic techniques. But what happened is that people weren't really asking for advice about the specific thing that I was interested in studying. And it opened up this world of mental health to me. So a different audience, primarily adolescents, were using it to disclose self-harm and really sort of tragic events that were going on with them where they needed people to talk to. And that just opened up my world to this kind of, we have these ideas about businesses that we want to create and problems that we want to solve. And sometimes you cast a net and you get something completely different, or you end up in a place where you didn't expect to be. And sometimes you have no choice but to embrace that and to figure out, well, why is this happening? As opposed to shutting it down and saying, like, you are not who I wanted to be here, and you're having a problem that I am not capable of solving as a social psychologist, was more figuring that out. So, we only have a few minutes left, so I'm going to skip a few twists and turns that brought me through the world of digital mental health into this more sort of positive psychology-oriented place where today I don't study so much crisis or self-harm, but instead the opposite of pathology. So we really focus on human learning. We look at growth curves and learning curves, and we try to understand why are people growing in the ways that they do, and how can we figure out what that really means. So one of the things that's really interesting to me is the difference between self-reports and then more naturalistic assessment. Like when we look at language, what can we tell about people, and how much do those sources agree? Or how much do others know you better than you know yourself? So your ratings of me as compared to my ratings of myself. We're also doing, as you said, AI is so sexy, so we are studying trust in AI, what makes people trust or not trust, when to disclose their feelings to an artificial agent, or really just any sort of knee-jerk reaction you may have to AI about using it in an interpersonal or psychological context. I also study coaching, which is a really interesting dynamic. We try to understand what makes for a good first conversation. So if we look through a recording of a conversation where people are talking about themselves and a coach is trying to reflect that process and help someone get to a particular goal, we try to understand what are some of the dialogue acts or ways that coaches can help people to figure out how to meet their goals or to grow in different ways. Interestingly enough, my research now is much more academic than it has been for the past 15 years. So my group does a combination of advanced analytics, foundational research, which is working with different scientists to do science for science's sake, and then next-gen innovation. So building tools and sometimes AI, but sometimes just sort of innovative ideas that help people understand themselves and interact with others. I hope I've addressed the question. I mean, now you know I'm here. I got here through some of those ways. I think that whole idea of thinking about your growth curve and then figuring out where you are on it and where you want to go is a really interesting process, but I wouldn't say that I'm somebody who has had particular goals. It's more of a curiosity thing, right? So I always make sure that what I'm doing has been intellectually engaging and psychologically rich, and whenever it's not, I can sort of identify those behaviors of wanting to leave or itching to do something different, and then going with it. So I don't have actionable advice in,
That's okay.
in those styles, but ask me anything, Nancy.
No, I was saying, so you work with Jamie Pennebaker? Is
I
that the
did,
right? Okay,
yeah.
so Jamie Pennebaker was one of a speaker at a very first TEDx event that I did back in the day, and he'd written a book called The Secret Life of Pronouns, which is, again, how your use of pronouns reveals something about yourself. And you're writing him an email, and you're so aware of every pronoun that you put in that email after it, and trying to figure out if I start the sentence with me or I, right? Is that the wrong way to go?
I know I've been worried if she's been analyzing my linguistics as we've been sitting here.
But part of what I'm thinking about is there was a stat that I showed at the very beginning of the start of this thing that talked about the amount of data that's going to be created over the next few years, right? 181 zettabytes of data by 2025 or whatever that crazy number is. So the amount of data that you have to analyze now has got to be extraordinary, right? And this is, again, where Victoria's work and your innovation, like you have more to work with now in terms of insight around that stuff. So I think that that's a really, really fascinating area where you again go back to where does data science be applied? Can it be applied? It's in all of these different areas. And the other thing that I watched Kate do last year was moderate a panel here at South by Southwest on psychedelics, right? And it was an interesting conversation about the role that will play in our mental and emotional health and social health as we move forward, and how we move it again from a prescription right now to think about pathology, right? We think about it a lot in terms of depression and PTSD and suicidal ideation too. Like, what does it open up in terms of like amazing capacity in terms of being able to see the world differently or ourselves differently? Do you want to say anything about that?
I mean, the thing I would say about big data is that it's not just the amount of data and the technical infrastructure, but how we analyze it and the extent to which we have other eyes on the process as well. And I think that's applicable in life too. Like, don't be intimidated by the data, because everybody needs to have a different perspective on it to make sense. I think it's a sort of like your interdisciplinary message of like, watch how others approach data and don't discount methods, particularly like brushstrokes like qualitative versus quantitative. We really, the only way through big data is through many perspectives and many hands involved.
Right, and that's, to me, is the whole thing, again, that helps us navigate the bias in the data. If you have a very homogeneous group, no matter what that group is, it will have a very narrow perspective. And the broader we can make those groups, the more that we label the data, we decide which data is important, we decide how the data is applied is so relevant. Z, any thoughts or questions?
I mean, I think the other two topics or panels are ones that I think I exist in. This is the one that's like so foreign to me, so it's very fascinating. So I feel like I'm more of just soaking things in right now.
Yeah, it's interesting. So the very first time we ever piloted this, actually, we did it. We had the woman who was going to become the president of the American Psychological Association. Is that who the one? She was.
American Medical Association.
Maybe it was interesting. It was a woman who was going to become head of, I think you're right, maybe in the AMA, and she had no understanding yet of AR or VR. And Zane had started giving her a way of describing about how you could use this to explain to a patient what was going on in their leg as they were trying to figure out physical therapy or trying to help doctors envision a surgery. So he was going through this whole conversation with her.
From when I tore my knee and our doctor handed me a book. I was like, what do you want me to do with this? And then they opened it up to the page and it's like, oh yeah, this is your knee right here. And I'm like, okay. But then, I mean, I come from the immersive tech world and I'm like, oh my gosh, this is, to the question about low-hanging fruit at the beginning of this call, it's like, those are the kinds of things that like, this isn't even 20, 25 years. We don't need tech to do anything crazy to get there.
Right.
We just need kind of someone to understand this world and then someone understands that world and kind of says, what can we do together?
About 7 years ago, we ran a workshop in Chicago. Love that place.
Literally was vacationing there.
It was for a different program. We were working with IBM, Watson for Health, Google.ai, Amazon's architecturalist platform, and a few of the companies, Microsoft's ontology engine. We were making the first voice support assistant for physicians so that they could have a conversation with patients without breaking eye contact. Rather than going, so tell me about your problems. Yeah, I'm listening. Yeah, just carry on. Right, and how do you feel about that? Okay, fine, I'm going to put in grumpy, whatever. So it was a moonshot, right? So that it was never the intention to create the world's first intelligent voice assistant. In the end, we made it, right?
Wow.
But there was 3 or 4 things that came from that moonshot that went into production with a large pharmaceutical. The immersive workshop we ran in 2015-16 had like mini projectors that would project the anatomy of your muscle and veins and arteries and bone And it was like, whoa, this is so cool. Then like you'd get one physician just going, that's never going to work in a hospital setting. Investment, infrastructure, approvals, supply chain, software updates. We can't even get our EHR systems on the same level of firmware. So there's a lovely idea of inspiring, but then practicalities. And that's not even touching the whole data, part of it. But in terms of data, the one thing we've learned with the aging program is that the most powerful use of data is to facilitate a different conversation between the service user, the patient, and the physician or the community support nurse. And things like a 68-year-old female watching her weight gradually come down without your yo-yo diet, or seeing her grip strength improve, which is a leading indicator of strength and independence. All these measures of data that are actually used or surfaced between the physician and the patient can really transform one's belief that they can be on a journey of sustained longevity rather than just sort of a one-shot, campaign.
Again, I could ask many, many, many questions. I have so many thoughts at this, but do you guys have questions of these folks? You have this amazing opportunity to speak with Kate and Ben and Victoria, who are obviously creative leaders in their field. Any thoughts or observations? Thank you.
Considering all the bureaucracy and all the processes and current healthcare systems around the globe, so how do you work in this field to make those changes happen? So how are you doing?
How do you navigate the bureaucracy that exists inside these systems, what you were just talking about, right? So you're saying, we've seen that even, again, in the world of AI, right? Where there are all these discrete units inside, from I get my radiology over here and I get my doctor over here, and none of these systems connect. And we can envision these incredibly fluid systems. But are we making progress in breaking that stuff down, and how is that?
I mean, for us in the digital surgery space, right, we're dealing with just one part of the healthcare system, which is surgery. And I've watched a lot of companies out there that are doing AI within healthcare, and the regulatory aspect of it with the FDA, right, is a challenge. And how do you get those? How do they audit those? How are those getting passed? Like, how are they actually applying those in a clinical setting? And I think the only way to figure it out, I don't have an answer for you, is to just go do it and experiment with it. I don't think you have to have a strategy in place to go start. And so for us with deep surgery is just getting out there and actually starting to do it, because that's when you learn and that's when you figure out where am I gonna run into these bumps against regulation, and what are the questions I really need to be asking that are gonna help me understand how I can break the system down or change the system from the inside in order to make these things happen. And so, but you bring up a great point in that we have to change the system. We have to relook. Just the system's been set up a certain way and working for a number of years, but with technology the way it is these days, with the amount of data that we have and the fact that we're really trying to leverage that information, we have to also rethink how the system is set up and change those processes and the bureaucracy around that, or I don't know. I say burn it all down and start over, but that doesn't really work either. So
well, and there are times we try.
Yeah.
But it just when I gave one of the examples of a big breakthrough this year was the regulatory approval for lab-grown meat. Like, that's a huge thing. It wasn't even so much a science innovation, it was a regulatory innovation. The fact that that is actually happening faster. Or we think about 3D printing of houses. One of the things that's actually been restricting its growth is regulating its safety. And again, what we've also found is incumbent industries often throw up a lot of red flags because they're threatened by these advances. And so they try and scare us into these advances would be dangerous things until they can catch up, and then suddenly they become proponents of them. Right?
I have two builds on this. One is the aging program. We've found we can create momentum from within the communities. So a lot of what we do actually is just connecting existing services and saying, look, there's a walking club over there, there's a church group over here, there's a workshop group over there for widowed husbands, right? Pull you guys together and then go knock on the door of your local physicians to look at some EHR updates. And actually there's a bit of a public movement happening in the UK, and that's helpful. In the US it's slightly different, obviously, but in the US we have another example around clinical trial recruitment, trying to get more diverse populations involved in trials. And the FDA and IBP and other regulators are becoming a bit more flexible on things like turnaround times. Like, they're shortening their window for approving so that we can do more variations quickly. So we're looking at advanced segmentation through data analytics to look at more kind of data-driven and hyper-relevant personas for underserved communities. And we're saying, look, we need 10 different variations of copy and images for the same message, because it needs to reach a population that's across the state line, needs to reach a typical single mom who's struggling on Medicaid and all the rest of it. So we are seeing some good progress in terms of almost the approval of ideas, and so there is hope, and we are seeing good momentum in that sense.
And as you sit on the horizon of, again, what do we call it, positive psychology or personal transformation, or does regulatory fit in that? Does it become a...
Yeah, I mean, my lens on that situation is more about impact. And so how do you, given the opportunity to develop products or to publish academic research or to pilot in either of those instances, what makes the biggest impact? And then also what you focus your lens on. So one of the things I think about a lot is a lens of enjoyment, efficacy, or engagement. So are we trying to get behavior change? Are we trying to develop things that people like and so they'll do them? Or are we thinking about, does it work on psychometrically valid scales that will speak to regulators and say this is more effective than not doing it based on an RCT or a randomized controlled trial? And I think that one of the things that I've learned in that instance is that you have to ethically approach engagement prior to efficacy. So you have to get people to do the thing prior to testing if it works, which is a little of what you're saying. And I think it's very precarious advice to think about, I'm going to just, race into it. People probably think about Uber in this instance, race into it and do it and then ask for forgiveness. But that's not really my advice. It's to ethically think about how hard behavior change is before you think about how you're using psychometrically valid scales to prove efficacy. Mm-hmm. So it's really about cautiously thinking about how hard it is to get people to do things. And if you have some momentum that people are doing things and liking things, then you think about the right way to measure engagement. And while doing that, then you engage the regulators and you question why the regulations like state borders exist when you're truly helping people.
The difference is, I suppose, that regulators are there to regulate as opposed to invent. Mm-hmm. Right. So what we're seeing is a bit of a shift towards being more receptive to ideas, and actually giving them workload is never a good thing, but if it's in the long run, if it's going to benefit humanity and society, then I think we're seeing a bit more of a permeable kind of membrane, a substrate where there's a sort of preparation to experiment, because their purpose is to I assume to sort of say yes or say no, so they have to invite more ideas forward.
Well, one thing, just having been a former government employee, right, is a lot of government folks, and you're starting to see that shift now, but a lot of government folks are career government folks. And so they don't have an understanding of business, and they don't have an understanding of actually what's happening external to those organizations. Mm-hmm. And so a lot of it is also educating them and without biasing them, right, is bringing them into the process as a part of the process of understanding what you're trying to build, and then how that changes how they regulate and what they need to regulate. So get them to start thinking about that.
All right, we are clearly running low on time, but is there any other burning question or thought? Any here? Yeah, we're good. Oh, we got one more.
Why isn't medical data centralized so that if you go to a different hospital, it all connects together? I'm frustrated with, because I was in the Air Force before, but none of my medical records transferred.
You mean your stuff from Trident didn't show up at your doctor's office? EHR? No? Let's sidebar. I don't even know where to start with that one.
If only there was a silver bullet. I mean, that's the question we all ask the system and the government and different and all the time. Yeah, and it's. I think the short answer is we want to burn it down and start again, but you just can't because you would have meltdowns. So I would say time, money, and a general willingness to harmonise. Probably due to federated systems not all having the same incentive.
Well, I think what's interesting though on what y'all are saying about trying to be more innovative and people are listening is I've been working with OpenAI GPT-3 and they're HIPAA compliant now. Mm-hmm. So working in healthcare applications, knowing that the data I'm using is HIPAA's will make it easier for us when we finally scale. It's nice to see. Mm-hmm.
Hopefully we're on the cusp of solving these giant world problems and all this way. But thank you guys so much for making time. I know that again in the world of South by it's tough. I have to say, I feel really good on the promise that we made that we're going to scoop up some of the brightest people that were either in town already or were here for South by Southwest to be able to share these conversations with us. So I think that has worked out really, really well. So thank you guys so very, very much for your time.